Hey guys, this is Dr. Juan with Vitality Chiropractic. We're your chiropractors here in downtown Sarasota, Florida area. In this video, I wanted to talk about painkillers and specifically opioids medications. I had a patient that came in this week and he said he has been just addicted to opioids for a long time, and he wants to get off because he feels that they're not helping, and not to get into details about the patient, but it has affected his life, marriage, a bunch of other things, work. So I wanted to talk about this pain medications and how dangerous they can be to your life. And when I'm talking about this painkillers, I'm talking about your hydrocodone, your oxycodones, your morphine, all this kind of big pain medications that you get when you get into accidents or you have big injuries. So like Percocet and Demerol and Vicodin, there's you name it, there's a bunch. And how they work is when you take them, they work on your nervous system. And from other videos that we've talked, and you see here on my page, we know what the nervous system is, right? We have your brain, then you have your spinal cord that comes down, and then you have all the nerves that go all to your body, okay? Out to your arms, out to your legs, everywhere. If we zoom in into our nervous system, the most basic cell that we're going to find it's called a neuron. I know you guys, a lot of you are familiar with what neurons are, and they communicate between each other and transfer signals, okay? Transfer information, and one of them is pain. So let's say you have one leg of one neuron, and then here you have the other one, and they're constantly communicating. There's more going back and forth all the way from your brain all to your everywhere. Pain signals travel from the first one to the second one, right? So let's say there's pain signals traveling right now constantly because you're in pain. You take this medication, and the medication is going to come up here. We're talking about the painkiller. It's going to come up here, and it's going to block the signal. So now you're not transmitting from one neuron to the other the signal of pain. And on top of that, you are going to release more dopamine. Let's just write it here, dopamine. You're going to release more dopamine, and dopamine is responsible for a lot of things in your body. It's an important neurotransmitter, but it also increases that feeling of pleasure and happiness, and you get that high feeling that you might get with drugs like heroin and cocaine and things like that. So someone might think, oh, well, that works for me. I'm blocking the pain, and on top of that I'm feeling happy, I'm feeling pleasure. That's amazing. But we fail to see what the issue here is. Are we fixing the issue? Are we fixing what you have? Let's say your pain is because of a muscle strain or a misalignment, or you have a really bad muscle spasms, or you have a disc injury, or you have a strain, you know. This is not helping anything. This is just blocking the pain. So you're tricking your body into saying, I'm fine, I'm all right, there's no pain, there's nothing else that you need to do. And then the problem is you start getting more and more dependent on these medications because you keep taking, you're saying, this is what helps me. Every time I take it, I'm out of pain, but I'm not fixing anything, so you're taking it for years and years and years. And the problem and the issue is that you create dependence, and that's when things start going really bad. I'm going to read, this is from WebMD. I don't specifically like to use this website because I feel a lot of patients just like to diagnose themselves using this, but when it's for information for medications, I like to use it. And strictly from WebMD, it says, when you use opioid medications over an extended period of time, you can develop dependence. This can occur when your body becomes so used to the drug that if you abruptly stop taking it, you get withdrawal symptoms such as diarrhea, nausea, vomiting, muscle pain, anxiety, and irritability. So let me get this straight. And these are not just the side effects of the drug. This is just The drugs have other side effects when you start taking it. This is just from withdrawals when you create dependence. So let me get this straight. I am taking this painkiller because I'm in pain. But if I take it for too long, because I'm really not fixing anything, all I'm doing is tricking my body. If I take it for too long, it's also going to create some muscle pain. How does that make sense? I'm taking a painkiller, I want to get rid of it. I don't want more muscle pain. So, and on top of that, I might get anxiety, irritability, diarrhea, nausea. Why would I want to go through that? That doesn't make sense. And that it's dependence. If you take it for such an extended period of time that you get addicted to it, people who are addicted to opioids compulsively seek out the pain medication. They typically have behaviors that lead to negative consequences in their personal life or workplace. That sounds horrible to me. Why would I want to go through that? It just doesn't make sense. I'm going to give you a statistic, because it gets bad here in the United States. That's why there's such a big epidemic. 80% of the world's pain medications are consumed here in the United States. 80%. That is crazy. That means we have what, 195, 196 countries in the world? Only one, us, takes 80% of the pain medications in the whole world. That means that the other 194, 195 take 20%. And then we wonder why we have so many issues here, why we have so many anxieties and ADDs and ADHD and all this other, issues that we're constantly seeing day by day. Okay? That is crazy to me. So, I want to make this video for you guys to think. The next time that you're going to take a pain medication or a painkiller, or you're prescribed a painkiller, and that is the only option that you are going to be doing for your treatment. Think about all this. Think if you want to go through that dependence. Okay? One thing that I forgot to mention, opioids and those painkillers are in the same category as heroin and cocaine in level of addiction. So, not to say in a bad way, but if we sometimes look at cocaine and heroin users, and we say, oh, they're drug addicts, but we don't look at ourselves that we're constantly taking these pain medications and we can't get off of them, we're kind of on the same level. So, next time that you're taking this, just think about it. Just think about other options that you can have. Options like chiropractic, options like acupuncture, massage, physical therapy. All these options look into the root of the cause. We don't want to trick your body into stopping the pain. We want to fix whatever it is in your body and make sure that that doesn't happen again. That way you're free of medications, you're free of all this side effects and dependence and addiction, and now you live a healthier and happy life. So I hope this video helped you guys a little bit to think about this big pain medication epidemic that we've been suffering for years. And if you guys have any questions, you can comment below, or you can call us. The information on our office is going to be right after the video. I hope you guys enjoyed it, and always remember, take charge of your health.